Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way Yorkville. Happy Monday evening. As you can imagine, I didn't have time this month or this week to come up with a new topic. So when I do that, it just means question and answer. And sometimes it's very, very taxing to be in full-time practice, come up with a new topic, prepare everything, especially because most of it I do is on the weekends. And I happen to be out of town this weekend. I took my family we watched the CrossFit Games. I don't know if you guys watched that or not. Had a great time on Sunday watching the CrossFit Games. Got to meet some awesome people. And so I thought, you know what? Let's just do a question and answer. And so you guys will be the the celebrity for our live, and the focus will be on you. So if you are watching us right now, make sure that you say hello. Let me know also where you're watching from. I know that we have people from South Dakota. Hi, Georgia. Michelle from Dr. Nate. From Dr. Nate. She said, "Hey, Dr. Nate from Arizona." Thank you so much, guys, for watching. Michelle, I know that you faithfully watch as well. From New Hampshire, Donna, thank you so much for joining us. And make sure if you're following on Instagram, right now we're streaming on YouTube. Right now we're streaming on Facebook on a couple of platforms, and also on the Rumble platform, and then also streaming via phone onto Instagram Live. So while we have people joining us right now, just a couple of things that we're going to be going over. And number one, our next inflammation talk is in 3 days, guys, in person. I know that we got a lot of people registered for that. Guys, the most important thing that you need to address first and foremost is inflammation. Everybody has heard about it, but very few people truly understand what inflammation is. The interesting thing about medicine is that medicine treats the effects of inflammation, or they try to knock out the immune system to try to lower inflammation. But what's interesting is none of it actually gets to the reason why the immune system is having that response. And so at that event, we talk about why the immune system is having that response and some of the first steps that you can do in order to get that under control. Remember this, the body doesn't make mistakes, the body adapts. And so if you keep injuring yourself, the body has to adapt to that. And that adaptation is what we call weight loss resistance, or cancer, or infertility, thyroid disease, arthritis. Type 2 diabetes is an adaptation, autoimmune conditions, hormone issues, all of those things in which we've seen new people, just this week, tons of new people this week who have all of those problems. You got to remember this, is that when people come to me, I'm not their first line of defense. I'm their last. I am their last hope. And I know a lot of people, in certain professions will argue all the time. And it's like, you have to understand, we are filling a need that people who are suffering with, who have not getting any answers. And we help to answer those questions that they have, but we come from a different perspective. So guys, if you're from the Chicagoland area, go to the top of the page, go on Linktree, make sure you get registered for that event in person if you're from the Chicagoland area. If you're not from the Chicagoland area, and you are in the contiguous 48 states, because I got a lot of people who want me to help them from Canada or from Europe. It's very tough for me to be able to order the test, be able to get what people need, because it's got to cross borders and things like that. And so we are, until things relax. I don't know, maybe they will relax in Canada with the recent news. But if you are in the contiguous 48 states, go to the inflammation webinar. You can register for it. You can watch it on demand if you have an hour of your time, or you can go ahead and register for it on, I think, Tuesday evenings it might be 6:00 Central Standard Time. And register for that. And if you watch it all the way, there'll be a link that you can schedule a one-on-one consultation with me and over the phone, and we can explore the possibility of working together that way as well. So make sure you guys get registered for it. This is, if you understand this, you will understand a lot of things. And guys, if you are from Michigan, if you are from Indiana, Wisconsin, Illinois, heck, even Iowa, I want you, please get registered for this event. We have Dr. Patrick Flynn, who is probably one of the foremost experts on hormones in the whole entire world. He's going to be coming, yes, to Yorkville, Illinois, Tuesday, October 24th, 2023. It starts at 6:00. And he is going to stop here on his I Disagree tour. And he is, I believe, going to be at probably about 30 different locations. We were selected as one of the locations in the Chicagoland area. and he's going to be giving his I Disagree talk, guys. This one is better than a concert. This is better than any one of my lives. This is better, literally better than anything that you have ever heard. Because when you hear his perspective on male hormones, female hormones, when you hear that perspective, you will understand why, in the Wellness Way approach, why we disagree with hormone replacement therapy, both for men and for women, why we disagree that birth control is the only option, why we disagree that when it comes to a woman's menstrual cycle, drugs, birth control, things like that is not the way to go. And he provides such a unique and fresh perspective. I can't even stress it enough. So guys, if you go to my link tree, or if you're on Facebook, go to the top of the page and you should see the I Disagree the tickets that are now on sale. Be the first people to get that. I know that it's coming up in about 2 months, but please, please, please get tickets. We're expecting 150 to 200 people at that event. We got an awesome venue already rented out. It is going to be an incredible night. I promise you that. I can't stress that enough. So make sure you guys that you get registered for that as well. So while we are waiting for people to jump on, I know that we have a lot of people on Instagram. We have a lot of people right now that are on Facebook and also on YouTube and probably on Rumble, but I can't see those people because it doesn't load onto my software. I want to ask one question that a gentleman sent me earlier today. He said this: "Hey, Doc, I hope all is well. My question is regarding sleep. How can I reset my schedule to sleep and wake up earlier?" So it's kind of a two-part question, guys, because sleep is very, very important. We all know that sleep is important, but we don't understand why it's important. Well, your body will always leave you clues. And one of the things is that you'll have noticed when they have done studies and they look at people who do shift work. So they do night shift work, and then they have to sleep during the day. Well, they actually notice that those people have a higher incidence of cancer. And you're like, well, why on earth would that be? And it has to do with your circadian rhythm, and it has to do with melatonin. Everybody thinks that melatonin is some kind of sleep hormone, and it's a repair hormone. And so if you are really, really not getting the secretion of melatonin in unison with the sunlight, you are really doing yourself a disservice when it comes to melatonin secretion and repair. It's kind of like, that when people don't get enough sleep, their body just continues to go into disrepair. And this is also true if you're trying to work out and try to skimp on your sleep, and you'll see that your body starts to break down as well. So sleep is really important. Sometimes when people are doing shift work, we do give them melatonin as well. Remember, it's a hormone, so we're trying not to supplement with any kind of hormones like melatonin, DHEA, things like that. But how can I reset my schedule to sleep and wake up earlier? This is kind of a simple solution. Is what you do the first morning is wake up when you want to wake up. I mean, it's that simple. So if you went to bed at midnight and you want to start waking up at 5 a.m, then go to bed at midnight, wake up at 5, and then the next day you will be dying to get to bed early. Okay. A lot of people will say, oh, I'm a night owl and or I'm not a morning person. The reality is it's not that you're not a morning person or that you're genetically not a morning person. Usually it is, I don't have the discipline to get to bed on time type of person. So anybody can reset that circadian rhythm by just waking up earlier, and then, go through you'll probably slog through your day a little bit, but then you'll want to go to bed earlier at night. So it's really important, guys, to be sleeping according to the sun and night cycle. So according to daylight and day, and when the sun sets, because that is when your hormones, melatonin and cortisol, are really working in unison in order to get you ready to lower cortisol and to increase repair and inflammation, and to actually decrease your energy. It's how those hormones actually work. And so that's why cortisol and melatonin kind of go hand in hand, because cortisol is supposed to go down, melatonin goes up in order to provide healing and repair. And, this is why you wake up sore. You might wake up stiff in the morning. It's not your bed. It's just how much your body had to repair during the night. Even when you're doing exercise, guys, I tell people, because I've trained a lot of athletes, and when they start training the way that I tell them to train, which not everybody, might not be everybody watching, But I say, hey, congratulations. Now that you're training this way, you're going to need to add another half hour to an hour of sleep. So that's just one of the things, the benefits, I guess, or the drawbacks, depending on how you want to look at. When you do start exercising in ways, you need to make sure that you're getting enough sleep. You skimp on sleep, the body will start to break down and it will go into disrepair. Second part of this question, though, is when the weekend comes and we get off track, is there an easy way to quickly reset? So I would say this, because a lot of people do get off track on the weekends and they will mess up their sleep cycle only to have to return to it by Monday. Best thing that I can tell you is don't mess up your sleep cycle on the weekend. So don't go to bed later. Don't wake up later. Don't mess it up. Your body will thank you. It's just, if you normally go to bed at 10 o'clock, go to bed at 10 o'clock on Friday, go to bed at 10 o'clock on Saturday. And I understand when people are young, they want to, they want to go to bed late at night and enjoy the weekends. But sometimes I'm like, just get to my age and you really don't have anything to do. So you just go to bed on time anyway. But if you do get it off track, one of the things that people can take that can help restore their circadian rhythm is something that's known as ashwagandha. So if you ever heard of ashwagandha, it is an adaptogen. It's not a stimulatory herb, but it's an adaptogen. And it's kind of all the craze right now. But guys, this has been around. I've actually been using it for probably about 10 years. So do I use it? The answer is yes, I do, just mainly because of how I exercise and how I train, and trying not to be extremely cortisol dominant with how much I train. And we do give it to a lot of women, but yes, it can help to restore your circadian rhythm. And in fact, a lot of times when people are like, it's midnight and I'm absolutely wired and I can't get to sleep until 2 a.m, and then they have to wake up at 6 and they're absolutely exhausted and they start waking up again, at 8 or 9 o'clock. Well, your circadian rhythm is off by about 3 hours, and ashwagandha is something that can help to get that back a little bit better. That's why I'm an absolute fan of it. Not everyone should use it, but a lot of people would benefit. So number one, don't get off track, but if you do, ashwagandha is something that can help. So guys, let's do a little bit of live question and answer. And let's see if I can actually just bring up maybe my screen a little bit and bring up some comments. Okay, so from Instagram, and thank you guys. We'll try to get through these and catch up. Try to catch up as much as possible. So Instagram asked a pretty interesting question. The interesting question is asthma genetic? The answer is no, it's not genetic. If asthma was genetic, it would be expressed from birth. When does asthma start to get expressed? Later on. And in fact, I'm answering this from someone who was on an asthma medication and inhaler from about 4 years of age. Interesting enough, send me a direct message. I'll tell you exactly when it happened and why it happened at that age. But asthma is not genetic. It's an inflammatory condition. You will even notice that exposure to certain foods can bring an asthmatic response. And so if you look at asthma, the biggest thing that you have to repair is you have to repair your barriers. So you have an immune response at the lung barriers. You also can have an immune response at the gastrointestinal barriers. And that's why usually people just don't have just asthma by itself. Usually they're having issues with the gastrointestinal system, with the lungs, and even sometimes with the skin. So you'll notice it's an inflammatory response, but also some of the other barriers, you will have an inflammatory response, which is why you guys will see kids who have asthma, then they also have problems with their tonsils. They also have allergies. They also will have sometimes even gastrointestinal system. They will also have, things like eczema, psoriasis, and things like that. So just remember, if it was 100% genetic, and that's what I was told growing up too, oh, it's just genetic, there's nothing that you can do, which is one of the biggest travesties, I think, in healthcare is when they can't explain something, they just say genetics, which takes away all of your hope and takes away any incentive to try to get yourself better. And this is coming from someone who is a former asthmatic, because I was on asthma medication from the time I was 4 years of age. I threw away the inhaler at, I think, 23 years of age was the last time that I used it. And I haven't touched it now in 23 years. So here's someone who doesn't no longer have allergies or doesn't have asthma yet. This would absolutely devastate me every single year. In fact, I had exercise-induced asthma. You name it, I had it. And so I no longer have it anymore. So just remember, it's an immune system issue. So thanks, guys, so much for that question. With asthma, usually what we're testing for is food allergy tests, sometimes even doing a stool test as well. Another question, and I'll bounce back to Facebook as well. I've been on blood pressure medication. It's been good, but I just had a spike and had my period. I'm thinking if there might be a connection with my hormones. Yeah. So the biggest thing is someone is on a blood pressure medication. Sometimes the type of blood pressure medication that you're on can leave you some clues. And so sometimes people are on a beta blocker, and a beta blocker doesn't really work with the heart as much as it blocks the receptors for adrenaline. And so that will lower your heart rate, and that will also lower your blood pressure as a result. Then you got your ACE2 inhibitors, you got your angiotensin converting enzyme receptor blockers. You got your diuretics, your calcium channel blockers. So sometimes it's important to know what is actually the mechanism of what is actually causing your blood pressure to go down. But if you had a spike during starting your period, can it be related to hormones? Yes. Can it be also related to stress levels? The answer is yes. So is it possible to be able to go off of blood pressure medications? Yes. I always scream, figure out the reason why. Is this a stress issue? Is this an inflammatory issue? Is this also a chemical issue that's going on? Heck, sometimes even it can be related to having low potassium levels. If you have very high sodium levels, low potassium levels, that's a recipe also for high blood pressure as well. So yes, can it be related to your hormones? The answer is yes. Okay. All right, let's go over to Facebook. I know Instagram, you won't be able to see that. Let me see if I can answer this question. I can bring this up. I recently had an ultrasound of my thyroid. The technician said I had a heterogeneous thyroid. I have a medical doctor next week. What advice do you have? Gosh, now I just brought up a question that I'm unsure of. Heterogeneous thyroid. Please describe that just a little bit more. I know that I could look it up kind of on the spot. A lot of people they'll get an ultrasound on the thyroid and they'll see the presence of nodules. And so if people do have a presence of nodules, the two things that you have to look at is there an immune response to the thyroid tissue? And is there some thyroid damage that's actually happening? And that can be related to deficiencies of selenium. It can also really even be a deficiency of iodine, but it also can be an immune factor, due to things like food allergies, Epstein-Barr virus, things like that. So you also have to, if the immune system is going after the thyroid and it's developed as like a sore or a blister, which is kind of what it is, then there has to have been some kind of injury. You got to figure out why there is an injury that's going on as well. So thank you so much for that question. Hopefully, I don't know if I answered it satisfactorily, but I try. All right, let's go back to Facebook. Can you talk to us about ways to help with high blood pressure? Okay, with high blood pressure. There's numerous reasons why there can be high blood pressure, but basically, if you look at it, if you look at the artery, so in the artery opens up, blood pressure is going to go down. When the artery gets smaller and more constricted, blood pressure is going to go up. So just think of a hose. When you have a garden hose and you restrict it, water goes through it with more pressure. You need more pressure in order for it to go through. So I want you to look at blood pressure as not the problem. The blood pressure, high blood pressure, is actually the solution. And it's a good solution temporarily. It's what the body is doing, but there's going to be a consequence over time. And so that's why when you look at blood pressure, you have to look at physical, chemical, and you have to look at mental. Because I want you to think of this. If a bear is chasing you, then your blood pressure better go up. And that's what I ask people at the inflammation talk and say, hey, if a bear is chasing you and your blood pressure goes up, is that a good thing or a bad thing? And everybody says that's a bad thing. And I said, well, if your blood pressure didn't go up, then you'd be dead. Okay. So your blood pressure has to go up as a stress response. But the other thing too is not only can it be stress related, but it can also be inflammation related as well. So if you're having some issues with inflammation of the endothelial lining, you get plaquing, things like that. You can get hardening of the arteries, and they're not going to be as flexible as they were before. A lot of that has to do with handling the inflammatory triggers, handling your blood sugar, no doubt about it. And we've gotten a lot of people to be able to go off of blood pressure medication. In fact, a gentleman last week, he's like, Doc, he's been on blood pressure meds for years. He's like, I'm super dizzy now. And I'm like, you need to talk to your doctor and have him take you off of your blood pressure medication, because his blood pressure medication was running at about 90/60. So you have to look at the endothelial lining. You have to look at nitric oxide production. You have to look at stress. You have to look at your blood sugars. All those things can play a role, with it. And that's why I always say, Donna, please work with or Lois, who might be asking this question, please work with a Wellness Way doctor who knows how to test you properly and give you a plan in order for you to be able to move forward. Yep. So one more from Facebook: best way to protect yourself from a leaky gut. So you're not really protecting yourself from a leaky gut, as leaky gut is a result and it's not necessarily a cause. Best way to protect yourself from a leaky gut: number one, make sure that you're getting enough stomach acid. Make sure that you're getting enough pancreatic enzymes. Make sure that you're getting enough bile acid release. Which is why a lot of people can develop a leaky gut if they're chronically low in stomach acid due to stress, or if they are they don't have enough bile that's released. So they might have bile sludge, might have bile stones, gallbladder stones. All of that can play a role in it. In fact, we just had a woman who's got a lot of leaky gut type symptoms, and has very, very high fat in her stool. And I said, I think your gallbladder is having a lot of issues right now. So we're helping her with that so that her gallbladder can actually release enough bile to be able to break down her fats and things like that. First thing is stomach acid by far and away. And then, number two, then you have to make sure that your gastrointestinal barrier is not inflamed, because when it's inflamed, it becomes more leaky. So stomach acid, no inflammation of the gastrointestinal system, proper bile acid production. And the other thing is too, is like antibiotics, chronic pain medications, NSAIDs, glyphosate can be another one, as well. So there's a lot of different things. And so the effects of leaky gut are going to be a lot of food allergies, and then a lot of inflammatory issues that are going on. The immune system gets very, very angry with it. Heck, and even how your microbiome can influence whether the gastrointestinal membrane integrity as well. So there's a lot of different things that are going to be at play here. Let's go to Instagram. Thank you guys for the question. I'm not going to pronounce this. Rebi Doi. All right. Is vaccine shedding real? Okay. So I see what you're doing with that. It's one good way to not get banned. By the way, if you're watching on YouTube, or if you're on Rumble, if you're on Facebook, one of my accounts on TikTok, yes, I know TikTok. I know. At 150,000 followers, I learned that I got banned this weekend. So so cut out my tongue, and I will learn sign language. That's just how I roll. You can knock down my anthill and I'll build it right back up again. And so that's what I intend to do. So the idea of shedding, is that shedding real? Well, let me give you a kind of an example, and this can kind of answer your question without directly answering your question. So I want you to think of this. If you ever taken like oil of oregano, and in fact, and sometimes we give it to people in very high doses, they come back and they're like, Doc, I kind of smell like Olive Garden. What's going on here? And I'm saying, well, even the foods that you eat, you can smell it coming off of your skin. The other thing is too, is I've had people and seen people who were undergoing chemotherapy, for example, and they literally had the smell of just rotting flesh. And what's happening with chemotherapy, you literally have a lot of cells that are dying off. People who are, for example, have kidney issues, they will smell like urea. So it can come through the skin. So to answer your question is if a supplement, if chemotherapy, of having kidney issues, being a type 2 diabetic, having high blood urea nitrogen, if that can make you smell, then can those other things actually shed? And the answer is yes, that I believe that it does. And in fact, I remember seeing patients who didn't really tell me that they had gotten the you know what, and I would walk into the room and my eyes would absolutely just burn. It would burn terribly within about a 5-foot radius. So do I believe that that happens? The answer is yes, I believe that it does. So thank you so much for that question. Thank you for masking that question too a little bit. So you guys got a question, make sure that you ask it, and I'll try to answer it as best as possible. So we got about another 35 minutes. And so I'm trying to keep up here on Instagram. All right. So don't supplement with DHEA. I don't recommend supplement with DHEA. There are certain cases that you should, but DHEA is a androgen. And you got to figure out if you are low in DHEA, why you are low in DHEA. That's the biggest thing. In fact, the only really time that we recommend DHEA or things like pregnenolone and things like that is when a woman who should be of cycling age gets a full hysterectomy, and she's got to keep her hormones up until she should be at the age of menopause. So that's why when we are measuring hormones, we're measuring how they're getting metabolized, because it can very well metabolize into some high androgen type symptoms, and that's why you just got to be careful of. So hormones don't cause, they respond. So yes, they'll make you feel lousy, but they're not the reason why you're feeling lousy. So, and that's why everyone wants to just measure a hormone and then give you a hormone as if that's the answer. You have low T, take T. If you have low progesterone, take birth control. If you have low estrogens, you need to supplement with, even hormone replacement therapy or even an estrogen-based birth control. Okay. So, while it will help you feel better temporarily, there's going to be some crazy consequences. And in fact, you don't have to look very far. Is look at what they did with women with Premarin, back into the 1980s and 90s with hormone replacement therapy, and just look at the number of breast cancers that caused that. And then look at how breast cancer has actually gone down. And you'll notice that they're not giving women Premarin anymore. And they said that that's one of the biggest reasons why we saw cancer numbers go down back in like the early 2000s, I believe, was because they stopped giving hormone replacement therapy and actually causing hormone-based cancers. Okay. So thank you very much for the question. All right, let's see, take one from Facebook. I'm curious about cholesterol, hearing a lot of talk about how you shouldn't take medication to lower it. Is this true? I'm going to give you my question when it comes to cholesterol. Okay. Here's my opinion on cholesterol. You're gonna believe that either the body is smart or the body is stupid, that the body makes mistakes or the body doesn't make mistakes. And you look at cardiology, you look at medicine in general, that they're saying that the body is going to mess up and cholesterol is going to start to go up. If this was truly a genetic issue, your cholesterol would be high from birth. Yes, there are certain people who do have what's known as familial hypercholesteremia, and their cholesterol is very high from birth. And we're talking about like total cholesterol in the high 300s, and in that case, hey, thank God that we have medication. But that's really only, don't quote me on the statistic, but I believe only about 1% of high cholesterol type issues that are going on. And so, Dr. C, if you notice that your cholesterol goes up as you get older, then why would it be genetic? Because again, just like asthma, genetics should be expressed from birth, and it's not, and it's expressed the more and more that you get beat up, or it starts to be expressed the more peripheral damage that you have. Just remember this: your body uses LDL in order to manufacture your hormones. Cholesterol that's carried by LDL is needed for cortisol or stress hormone. It's needed for estradiol, testosterone, and things like that. So if the cholesterol is actually going up and you're getting more cholesterol production coming from the liver, then you have to figure out, why does my body making more? And so they say it just goes up and that cholesterol just randomly gets deposited in the arteries. But guys, if you even read about what happens with immune system reactions, with macrophages, and the inflammatory response that happens underneath the lining of your arteries, it really is an inflammatory response. And in fact, they just did a study and they looked at people with high LDL, and the people who had high C-reactive protein had a lot more heart attacks than people with high LDL and with normal C-reactive protein. That's why I truly believe it's a inflammatory reaction. You have to handle the inflammatory triggers. And in fact, we just had a guy just with proper lifestyle and what we're doing, his LDL basically went from about 240 down to like 175 in a matter of about 4 or 5 months. Doctors will tell you it's diet and exercise. I'm going to give you 3 months to do it, but they don't give you any direction specifically with diet, specifically with exercise. They just tell you to do it, leave you to your own, I'm going to figure it out. And that's just a recipe for failure. So why don't doctors teach you diet and exercise? Well, number one, they may not have any training whatsoever. And number two, it's not reimbursable. They're not going to sit down when they're supposed to see 40 patients a day and sit down with you for 30 minutes and go over with you what you should be doing as far as a proper diet. They're not going to go to the gym with you and teach you how you should be doing exercise, weightlifting, high intensity exercise, because even there's certain types of cholesterol that won't be touched unless you are in fact doing high intensity exercise. And so that's why, heck, I will also say this. If someone has Lyme disease, if you are someone who has had Lyme disease, for example, check your LDL and see where it's at. Because people with Lyme disease will have very, very high levels, high cholesterol levels. And so if you do have just an extraordinary high LDL, I would be checking to see if you do have some kind of Lyme infection that's going on, some kind of biotoxic illness as well. Okay. Let me go back to Instagram. What is the best time to take ashwagandha? Thank you from New Zealand, the beautiful country of New Zealand. The best time to take ashwagandha is usually we'll have people take it before bed and then also when they wake up. And I'm unsure as far as the doses because we dose it actually through a liquid and not necessarily through capsules. What's the best thing to take for cold sores? I believe it's L-lysine, but then you also want to figure out with cold sores, why your immune system is so low. So just remember it's a herpes virus. And so when does it come out? It comes out when you're immunocompromised. You may notice that if you're a woman, you will notice that you will get a cold sore as you start your cycle. That actually has to do with your progesterone levels because progesterone is an immunosuppressant as well. And for good reason, because if you do get pregnant, you don't want your immune system and those natural killer cells going after the fertilized egg because half of the DNA is not yours. So that's why during pregnancy, the high progesterone levels prevents the immune system from going after the baby. Okay. So let me see. Because I know I'm probably falling really behind. Hi, Jackie. It's good to see you from Oregon. So Donna has a question. What are your thoughts on fluoride toothpaste and drinking water? What are the effects this can have on children? So here's the thing. I will tell you, I haven't used fluoride toothpaste for about 25 years. So, and actually I've had cavities. I've had less cavities over the last 25 years than I did for the first 21 years of my life. What's interesting, though, is when you look at too much fluoride, it can cause weakening and mottling of the teeth. Kind of makes you wonder, okay? Now, here's the thing. Even if they did, I truly believe that even if it did strengthen your teeth, I don't think that the benefits of fluoride outweigh any kind of tooth decay or anything like that. Because, guys, the number one cause of tooth decay is an acid that's formed by too many sugars. So high acid foods like sodas, number one, can wreck the enamel. Heck, even apple cider vinegar can wreck your enamel if you're taking it all the time and letting it touch your teeth. But then if you have a high amount of sugar, the strep bacteria take the sugar, they eat it, and then they're how they metabolize it is releasing an acid that wears down the enamel. So the best thing is don't eat a diet that's going to be high in sugar. Now, you will also notice that even some dentists will say, what's more important, brushing with fluoride or flossing? And they'll say for cavity prevention, actually flossing, because where the tooth gets stuck or where the food gets stuck is between the teeth. And that's what causes an inflammatory response. And that can cause some tooth decay as well. So my kids don't use fluoride. I don't use fluoride anymore. They've never had a fluoride rinse. They don't take fluoride at school. However, fluoride in high amounts can also be very toxic to the bone marrow. So when you get kids that are having certain types of tumor coming from the bone marrow as well. You have to wonder if there truly is a benefit. So my thoughts are no bueno. Okay. Another one from Facebook. Hey, Dr. Nate, what are your tips to women with menopause, knowing your hormones are transitioning the way they're processed in the body? Why is weight loss more difficult? Should exercise routines change? Sorry, I'm looking at because my camera is blocking this. All right, so here's the thing: women get very, very frustrated when it comes to menopause, because here's some of the things. Menopause, what you're going to see is a declining of hormones. Yes, that is normal. If your hormones are declining, remember this: you're no longer producing the estradiol from the ovaries, and your hormone production is going to be coming from the adrenal glands. So this is why it is very, very, very important to be taking care of your adrenal glands, because that's where your hormone production is going to be met, and it is going to be lower in your estradiol. It's going to be lower in progesterone. That's why when we measure it on a Dutch test, you have cycling levels and then you have menopausal levels. That's why the adrenals are so important. And you also will notice is that once you have a lot of things cycling women, the estradiol really does block a lot of issues that are going on. That's why you don't see women, have heart disease or have a stroke unless it's caused by birth control, like some kind of clotting problem. You don't see them have a heart attack. You don't see them have a stroke when they're cycling. When those hormones then go down, they start to catch up with men when it comes to heart disease. And in fact, they overtake men by the time that they're in their 70s. So your hormone contribution is going to come from two areas: come from the adrenal glands. It's going to come from your fat cells, which means that if you have some issues that are getting kind of covered up by your hormones, as soon as you hit menopause, all bets are off. And you will be exposed for having sassy behavior. All right. I hate putting it that way, but sometimes that's just what it is. And so if you are low and deficient in hormones from the adrenal gland, then what your body does is that it will basically help to put on fat in certain areas, because fat is in fact an endocrine organ, and it can make up for your estradiol production, which is why you will have sometimes some weight gain when it comes to menopause if you are extremely hormone deficient. And you do have to look at weight loss a lot different than a man. And that's why how many women have come to me and I've tried macros, calorie tracking. I've tried keto. I have tried everything, and you name it, and nothing is happening. The first thing that you have to look at is hormones. The second thing that I would look at is there's got to be some level of toxicity. There's a problem with your liver, because it's the liver that converts fat into water and energy. Look at the number of people in the United States who have fatty liver, and it's a lot. 2/3 of people, I believe, now in the United States have some level of liver inflammation and fatty liver. And this can also, help. One of the things with that, you have to take that in consideration. Then also take into consideration how you are exercising, which I'm a fan after menopause of doing more high intensity, short duration exercise and doing more weight training than going out and blasting yourself for 45 to 50 minutes doing long duration runs and things like that. So hopefully, Chris, that helps you just a little bit. Okay. Let's go to Instagram. Hopefully I didn't. I'm probably passing people up, and I apologize. So is 3 hours of sleeping enough to function properly during the day? Absolutely not, Dr. Sarah. And if you consistently do that, interesting enough, one of my best friends was a Navy SEAL, and he described his experience going through Hell Week, which is just like one small week out of their whole entire training. He basically slept an hour a day, I believe, for like 5 or 6 days. He said at that point he was absolutely hallucinating, and they have to actually, clear him. Medics have to clear them before they even let them go, because there can be some serious issues going on. So 3 hours, definitely not enough. If you're having a problem sleeping, you're only getting 3 hours. At some point you will pay the piper. and you have to figure out why you're having some problems sleeping. A lot of it can be related to mental stress and being able to turn off your executive function of your brain. A lot of things that can help can be magnesium threonate and chamomile taken right before, and that can help to shut it down so that you force yourself to be able to get some restorative sleep. Is it safe to take berberine before meals if I am also taking a metformin prescription? I would say this. It can be, but I would actually try to figure out why you are on metformin. So one of the things that I would say is when people say, hey, can I take this supplement? I say, hey, change your diet first. That would be way more important, is to change your diet. If you're taking metformin, basically how metformin works is it helps to put sugar into the cell and help the cell take that sugar and use it as an energy. You notice with type 2 diabetes is that they can no longer use sugar inside of the cell. And so their sugar metabolism becomes bad. And so their blood sugars are going up. Berberines, the whole idea with berberines is that, yes, it does work very similar to metformin. And yes, we do have people take some high dose of berberine, especially if they're having problems getting sugar into the cell. But you need to start off at kind of a lower dose, see how it goes, and then go to a higher dose. But we've had people take 2,000 up to 2,000 milligrams of it, per day. And it's not a long-term solution. Okay. So it's not a long-term solution to it, because we don't want you to be on it for the rest of your life. Metformin, if you go to WebMD, you will see on WebMD, it's funny, and it's also tragedy when you look at the long-term effects of being on metformin, what it does to the gastrointestinal system as well. So back to Facebook, Rachel, how safe is ivermectin if it can eliminate parasites in your gut? I guess I don't give opinions on medications and things like that. I can tell you though that I know that when people from Africa and from other foreign countries, when they come into or emigrate to the United States, they have put them on ivermectin because it is an anti-parasitic drug. Okay. There's some other anti-parasitic drug or herbs as well. One of them is known as wormwood. And so if people do have some issues with yeast overgrowth, or if they do have a parasite, which occasionally that we'll see, then wormwood can help too. You just got to be careful not to be on it too long as well. Wormwood does have the same kind of mechanism of how it works as things like ivermectin. And gosh, what was the other one? I should know this as well. The horse dewormer is what they called. Okay. But everybody says that they have parasites. And I don't think if you live here in the United States that that's necessarily true. So when people say, oh, I have parasites and blah, 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 parasites, remember this, is that the only way for you to truly get a parasite is for you not to be able to sterilize your food the way that it's supposed to. So that's the purpose of your stomach. And so if you do have parasites, you better fix why you have parasites. And a lot of it can be due to low stomach acid. Okay. All right. Thank you guys so much for your questions. I hope I can keep your attention long enough. Okay. All right. Severe EOE level 72 with dysphagia, asthmatic, allergies, skin test, no food allergies. So the blood test wouldn't be able to test for food allergies. Recent CBC showed eosinophils at 5.0. Wow. So Wonder Woman on Instagram, please reach out to a Wellness Way doctor. Go to thewellnessway.com and then just put in like your zip code, and you'll see if there's a Wellness Way doctor near you. And if there's not, you can find one that will work remotely. If you can't find one, please reach out to me and I'll do my best to be able to accommodate you. So send me a direct message. But this individual has all of the things associated with high eosinophils, which is a type of immune system reaction or type of immune cell. And eosinophils are associated with histamine. So I probably am assuming too, Wonder Woman, that you probably have some issues with some mental health type of things. I'm assuming, like whether it's anxiety or depression or things like that, that can play a huge role. Guys, have you ever heard, and in fact, if your eosinophils are that high, then in that case, there's probably a couple of things going on. Yes, you might have a parasite, but yes, you may also have multiple IgE food allergies. We actually do test it in the blood. and the whole thing that they're just doing some kind of skin test, they couldn't find anything. There's got to be something that's going on, and it may actually be parasites, especially if your eosinophil number is that high. Your body is trying to do something. Sometimes it can even be high. If women do have like breast implants and things like that, so it's just something that you can consider as well. But please reach out to a Wellness Way doctor. I wish they would tell me how far. Oh, I think I've caught up on Instagram. So good. If you guys have a question, please leave it. I've caught up on Instagram. Let me go. Let me go back to Facebook. What's the average time frame a person needs to be on Earth for ridding a parasite? After almost 2 years being released on Earth, one would hope to make dent ridding a parasite. Testing shows no movement. Yeah, sometimes you do need to go on some higher forms of anti-parasitic type of drugs. But if you have been working on it for 2 years, there's got to be some other issues that are going on, like low stomach acid. I would get a complete stool. Check actually for IgE food allergy, see how it's affecting that. Because if you do have that and you just keep bringing the body down by consuming that, very hard for the body, for the parasites to create an environment so that the parasites don't want to be there anymore. See, that's the thing, is that with parasites, you create an environment that they just don't want to be there anymore. It's kind of like the 30-year-old, son or daughter that hasn't moved out of the house. Why haven't they moved out of the house, guys? Because mom and dad, you've created an environment for them to want to stay. So create an environment that they don't want to live there anymore, like make them work and make them pay rent. And lo and behold, they move out onto, greener pastures. So it can be the herb that you might be on. It might not be enough. And also you may have some issues with low stomach acid and things like that. So thanks very much for your question. What can you recommend for a faster replacement or faster recovery of a complete shoulder replacement? So Lois, sorry that you got your shoulder replaced. That is not a great surgery to have to go through. One of the things, and anytime when people have any kind of joint replacements, I will tell you this. I can tell the people who are going to have a bad day with their joint replacements, or people who are going to have a less bad day, because it's not a easy thing to be able to recover from. But I also want you guys to know this is what destroys the joints. And one of the things that destroys the joint is actually going to be misalignment, right? If things aren't working the way they're supposed to, they're going to wear down faster. But the other thing is, who are getting the joint replacements are people who have blood sugar issues. And so if you would take out just a massive traumatic experience, you dislocate your hip, you dislocate your knee, shoulder, massive dysfunction and dislocation and trauma, that can cause an acceleration of degeneration. But majority of people that are getting hip replacements, knee replacements, and shoulder replacements, they all have blood sugar issues, and high blood sugars absolutely destroy and damage your soft tissue. So if you had a joint replacement, then you want those tissues to be able to heal around it, which is why, without knowing anything, one of the things is if you start trying to lower your blood sugars, stop eating so much, so much carbohydrate, especially processed carbohydrate, start working on it from that angle, and then making sure that you're getting things like collagen and things like that can help with joint and tissue repair. And there's a lot of other things without knowing, all of the background with it. Are bitter apricot kernels a good thing for stage 1 cancer? Well, here's the thing. There's a lot of things that can provide a benefit, but I'm going to tell you this, okay? When it comes to cancer, when it comes to literally anything, we're always trying to find the exotic and ignore the most obvious. I'm going to give you an example, because I went up to the CrossFit Games this past weekend. And I went through all of the different vendors, and I got to thinking, because the things that were there now were cold plunges. There was like 4 different booths with cold plunges. Things about this is the recovery drink that you need to be on. And I got to think, because I looked at that, and everyone was really excited about cold plunges and, these baths that you can put in your house, and they can have cold circulating water at about 40 degrees Fahrenheit. And I got to thinking, because I'm like, I came here 2-3 years ago and the flavor of the day was CBD oil and Theraguns. I didn't see anything there. And 5 years ago, it was like these compression boots and these electric muscle stimulators for recovery to pump the muscles. I didn't see any of them there as well. And it gets you to thinking, it's like, well, why do people not have an interest in them anymore? Because they may help, but they're not the big things. And so if they're not the big things, then they'll go away. And that's why you don't see a lot about CBD. Does it mean that it's not beneficial? It is beneficial, but I believe that the benefits were way overstated. It's the same thing with the cold plunge. It's beneficial, but I believe that it's overstated. CBD, cold plunge, compression, all of these different things. And so when it comes to cancer, you have to handle the biggest things. The biggest thing with cancer. Check your blood sugars, number one. Check your hormone metabolism. Depends on the type of cancer that a person is presenting with. Whether it's an endocrine type cancer, whether it's where it's happening. Is it happening because of injuries? Is it happening because of hormone? Is it happening because of something happened with the immune system? But ultimately, when you look at cancer, anything that is going to improve immune function and to starve a cancer cell is always going to be the way to go. And so that's why blood sugars are so important. And that's why the immune system is so important. That's why things like medicinal mushrooms, that's why if anyone who's got cancer, please get an immune system panel and look at what you are deficient in and then figure out why you are deficient in it. So does that mean that, apricot kernels are bad? No. But if you only do that while you're neglecting the main thing, then you are going to see very little benefit. So when people say, well, what do you do for that? I say anything that I know is going to help, that's what we're going to do. And especially when it comes to cancer, you want to throw the kitchen sink at it as well. And heck, even sometimes when we look at certain markers, we're going to say actually chemotherapy would be something that you need right now, because the immune system is not going to be able to catch up with this. And all chemotherapy is just doing the job of the immune system that the immune system failed to do. But here's what's so interesting. Even if you give chemotherapy, you have dead tissue, you even need certain immune cells like neutrophils to go up and clean up that damage. And I've had people come to me who went through chemotherapy and radiation for breast cancer, and they still had dead tumor tissue within the breast because their immune system still remained low and it couldn't clean up the dead necrotic tissue. Okay. So Chris, what advice do you have for an enlarged prostate? Number one, test your hormones. So you want to look at the hormones because certain hormones, DHT, for example, can grow the prostate. So you want to look at your hormone metabolism. This is actually why doctors will give a DHT blocker. What's interesting is that a DHT blocker, which they give to block balding, can also help to shrink the prostate because you're not feeding it hormone. Some of the biggest reason that can cause that to happen is high sugar, high alcohol can do it. But one of the things you can do to help with having an enlarged prostate can be saw palmetto in some pretty high doses. Because if you do have an enlarged prostate, then you're going to have a problem with urinating. You're going to have a problem with, I hope we can say this, ejaculation. You're going to have a problem with those things, a big time problem with those things. And I actually had a gentleman that I have been doing some consults with, and his prostate did get so enlarged that he actually couldn't urinate anymore. And they had to put a catheter in because the urine was getting backed up, and he developed a really bad urinary tract infection as a result. So get that under control. Start with some saw palmetto. Work with a Wellness Way doctor as well, so they can actually do the proper tests. Okay. All right. So do we have any more questions on Instagram, guys? So if you got a question on Instagram, and also guys, if you're on Instagram, please let me know where you're watching from. Let me bring this up too. And commercial break. If you guys again, are from the Chicagoland area, please get registered for the inflammation talk that's coming up. This is going to be this Thursday. Go to Linktree at the top of the page, and you'll be able to register for that in-person event if you're in the Chicagoland area. If you're from the contiguous 48 states, get registered for the inflammation webinar. You can watch it on Tuesdays, or you can watch it on demand if you have an hour of your time. And if you want to work with me directly, you'll see the link at the end. Once that the actual inflammation webinar starts to finish up, you'll see the link to be able to schedule a discovery call with me at that time. And then also make sure, if you are from Michigan, Iowa, if you are from Illinois, if you're from Indiana, Wisconsin, please drive down the Chicagoland area and listen to Dr. Patrick Flynn. He's stopping here on his I Disagree tour. It is absolutely amazing and fantastic. I believe that tickets are on sale right now, and they're only $15. And this is way better than going to watch the Barbie movie. I can promise you that. All right. No offense if you like Barbie, but it's not for me. All right. My hiking buddy has 2 large bone spurs and slowing down the hiking. And she's a wellness way patient working on the health side. What do you think she can do in order to help heal and get rid of them? Jackie, I'm not for sure what kind of bone spurs that they are. Are these like spurs on her foot, on her heel? They spurs on the bottom part. Usually if you are hiking, it can be, we're talking about spurs on the bottom of the foot or on the heel. If you can just please maybe clarify just a little bit. So awesome, guys. California, Louisiana, San Diego. Wow, that is just so awesome. Thank you guys for responding. I appreciate that. From New Zealand, I heard New Zealand is just an absolute beautiful country. I just saw a Netflix special about the volcano that erupted with the people that were on the island. I was absolutely in shock and horror that they were on that island. Unfortunately, a lot of those people passed away. So hopefully I haven't skipped. Quick question, follow up on joint issues. What are your thoughts on oral hyaluronic acid? No, not really, because just remember this is the body makes those. That's why I'm thinking a lot of things orally, it just gets destroyed in the stomach. This is why, interesting fun fact, why they don't give people oral insulin. The reason why is you give oral insulin as a hormone, and the stomach acid just completely destroys it, which is why they have to bypass the stomach and have to inject it straight in. Okay. But Jackie, to go back to this, if someone does have bone spurs on the feet, one of the things that can help so much is helping with someone who's a sports chiropractor knows extremities to help with, number one, with adjustments, but continue working on the inflammatory issue. But adjustments can help so much as far as the mobility and the flexibility of the feet. This is actually someone who I had a bone spur on the bottom of my heel. And it was so bad that it was actually poking. You could poke through, you could see a callus forming as a result. And I worked on it, did the right things, and it actually completely reabsorbed as well. So, all right. Are low estrogens and high vitamin D connected at all? Brenda, no. Mostly what vitamin D is connected to is absorptibility. So that's why women who've gotten their gallbladder historically do have low vitamin D, because you need the bile acid to absorb the vitamin D. And also you need liver, because it gets converted at the liver. So you get sunlight even, and it's not going to be getting converted into its active form. You'll measure it low on your blood test as well. So I think the biggest things is you actually do need higher vitamin D for bone mass and for even immune system function, even weight loss. It's been connected to. Heck, even higher vitamin D helps to slow down hair loss as well. Can castor oil packs help with bone spurs? I would say that it's debatable. Do the big things first, but a lot of people swear by castor oils over joints, over the uterus, and sometimes we recommend to put it over the liver in order to help with that as well. So Jackie said, yes, the heel. Yeah, if it's on the heel, please work with someone who would be considered like a sports chiropractor who knows how to do extremity adjustments. So Chris says, yes. Dr. Patrick's I Disagree seminar is awesome. Please bring up your partner. Please do that too. So guys, please bring, if you're coming to that event, please bring your significant other. I guarantee you it will strengthen your relationship because men don't understand women's hormones and women do not understand men's hormones. There's so many women who bring their spouse and their spouse begrudgingly comes because they love they love their wife, and the wife thinks that it's just going to be is going to be it's like a man bashing event, and it's not. Usually the men walk away and say, see, honey, I told you. But both of you will come to an agreement of saying, hey, we both need to work on understanding our hormones, we both of us. And if you guys can understand your significant other's hormones, I guarantee your relationship would get better. And this is not a relationship event, but you will walk away from that with a stronger relationship if you guys can understand each other's hormones. So thank you, Chris, so much for the recommendation. Bring your spouse. Okay. What about the effects of Tylenol? Not a fan of it. Acetaminophen. This is why they don't want you to give it to kids under 6 months of age. You guys know that? They're like, yeah, you can't give Tylenol to kids under 6 months of age. No, but no one really knows why, or they don't explain to you why. The reason why is that a child's CYP450 enzyme family that involves with the removal of toxins is not developed until about 6 months of age. So that's what's interesting, which means they can't clear out the acetaminophen. And so it has kind of a compounding effect. Body can't get rid of it. So it just keeps persisting within the body. So really think of this. If a child's CYP450 enzymes aren't developed by 6 months of age, what are we giving to children as soon as they leave the hospital and at 3 months well baby checkup, at 6 months well baby checkup? And what are we giving to them that can cause a huge toxic response with the inability to be able to clear it out? So am I a fan of Tylenol? The answer is no, absolutely not. Not in the least bit. Are there times where people need to be on an NSAID? Yeah, sometimes, unless you want to just really gut it out. But please, please, please don't take it long term. Please get to the reason why it's happening in the first place. Okay. So thank you guys so much for your questions. I really, really appreciate it. You guys are really, really awesome. So we have Western Australia, Melbourne, Australia, Virginia, Southern California, Louisiana, California, San Diego. Just awesome. Awesome. Thank you guys so much. Well, guys, I hope you enjoyed this as well. I always love, probably my favorite is answering people's questions. And I hope it always helps. And I always say this, guys, is I love, love, love your questions, but just help to see things from a different perspective. The perspective that we come from is, when you look at, I have high blood pressure, take a med. And it's a this for that approach. And then a lot of people say, I don't want to do that. So is there something natural? And I'm like, well, that's not the approach. That's just like sprinkling organic water on your fire. Is that, yes, it may lower your blood pressure, but it's still not getting to the cause. And that's why with the Wellness Way approach, we take a Swiss watch approach. We say, hey, the body is a Swiss watch. Even when you're looking at blood pressure, maybe the problem is coming from somewhere else. The blood pressure is an adaptation as a result. And so that's why you have to test it properly and you have to look at it from a Swiss watch. That's why we say the big toe controls the heart. And you may laugh and say I'm being ridiculous, but give me a hammer, I'll smash your big toe, let's take your blood pressure, and then I'll prove you a point that, yeah, your big toe can control your heart. And that's why you have to look at the whole body as a whole and not look at just one thing. I'm just going to look at just my blood pressure. I'm just going to look at my heart. I'm just going to look at, my hormones. And then we go to a general practitioner, then we go to a specialist and then a subspecialist. And then we keep going to more and more subspecialty, and they know more and more about less and less until finally they become an expert in nothing. And it really literally can get that bad, in which they're looking at one thing and the one marker gets better, but meanwhile you continue to lose your health and you don't even see it coming. So that's why, guys, with Wellness Way Doctors, we are absolute masters of physiology and master being able to put the pieces of the puzzle together in order to start looking at things from a different perspective. So Donna, thank you so much for your kind words. I appreciate it. Just make sure, guys, that you like, me follow, make sure that you share this video as well. Maybe I'll answer a question that someone else has. Last question, guys, that I'm going to answer. I think this one is really, really important. Sherry asked the question, your thoughts on compounded hormones for postmenopausal women? And the answer is, I am not a fan of hormones in general. Okay. Now, that doesn't mean if you have had some kind of hysterectomy and you still should be having a cycle, because then if you have a hysterectomy, let's say at 35 years of age, and your hormones are going to go so low, you should have some years in order to try to keep those hormone levels up. Otherwise, you're going to run into some issues with osteoporosis, maybe even some adrenal issues too, because that's where your hormone contribution is going to be coming from. But, you even have, natural health practitioners, and guys, a lot of them are in fact just medical doctors, and their approach is still a medical approach. They're saying you need to be. In fact, I saw a hormone influencer, and she said the cure for menopause is hormones, or the cause of menopause is menopause. And it doesn't have to be some kind of illness, but we've gotten to the point where we're looking at menopause as some kind of illness, when it is just a natural transition, So if a woman is postmenopausal and they're saying you need to be on these compounded hormones, you need to be on bioidentical hormones and things like that, I wouldn't touch it unless you were measuring how they were being metabolized. This is true even for men. So when men decide they're going to go on testosterone replacement therapy because their hormones are so low, I'm saying maybe we should fix the reason why they're low versus keep a person sick and just jack them up with hormones, because you'll see eventually what the body will start doing with that long term. And it's the same thing that if you're having problems postmenopausal, the hormones temporarily will make you feel better, but you do not know what the body is going to do with it unless you are actually measuring specifically on a Dutch test. And that's why we always say we're running to hormones versus trying to fix and clean up our lifestyle, handling physical stressors, mental stressors, chemical stressors that are going on. And you will see when you start to fix those things, the whole conversation about hormones goes away. And so that's the biggest thing that I can say when it comes to that. And not a lot of people like to hear that, both men and women. We get very emotional about it because that's what we want to do. And we don't like someone saying, I disagree with that as well. So Sherry, I think an awesome event that you should be at is Dr. Patrick Flynn's I Disagree. And depending on where you're at, if you actually go to, what do we have at Eventbrite? If you go to Eventbrite, which is where a lot of organizations, they run their events. If you go to Eventbrite, look up Dr. Patrick Flynn, and I guarantee he's probably doing an event close to you. So look at that. You don't have to come down to Chicago for it. You can find one that he's going to be at, because I know he'll be in Missouri, Wisconsin, Minnesota, Florida, all over the United States. Heck, he might even go out into Hawaii too, as well. So the question answer, thanks for doing this. Do you do this on a regular schedule? Usually if Instagram, I do this like once a week as well. So just make sure that you follow us, because I'll let you know when I'm going to be going live next. They'll usually give you about 24 hours of notification as well. All right, guys. So it's time for me to go. Mondays are very late nights for me. So I appreciate you spending this time with me. Make sure, guys, that you make sure that you follow us. Make sure that you share this video as well. I'll save this video on Instagram so that you can watch the replay. So guys, I hope you have, guys, seriously, a great week. And I hope you enjoy the rest of your week. Be well, be blessed. And like I always say, remember who you are. And if you want to, please follow me on my new TikTok account that got, after my other one got banned. All right, guys, be well. Hope you guys have a great rest of your week.